Okay, so tonight we will talk about chapter 9, which is the urinary system. You guys can read these terms later yourself. So I start with the function of the urinary system, and it is a very important vital organ which is important for homeostasis. Um, it is very important for balance of water. So if the body does not have enough water, is dehydrated, or it is hypovolemia, which is not enough blood volume, or the person has hypotension, which is decreased blood pressure, kidney tries to absorb as much water as possible. uh, Renin is an enzyme is produced by the kidney, and it's part of a big pathway. That the pathway is called RAS or AAS. You don't need to know the details, but just know that this is important for absorption of water and balance of water in the body. If the person has hypertension or has hypervolemia or too much water in the body, so the kidney tries to get rid of extra water. Also, kidney is important for balance of electrolytes, so it tries to absorb as much electrolytes after they are filtered from the kidney, so you don't lose too much electrolytes. And another one is that kidneys are important for the balance of pH, so the kidneys getting rid of extra hydrogen and absorbing bicarbonate. So this is why the blood pH is a little bit basic. It's not acidic, it's a little bit basic. Kidney also produces calcitriol. Calcitriol is coming from the metabolism of vitamin D3. So this is important for absorption of calcium from intestine and reabsorption of calcium from the kidney. Kidney also important for production of red blood cell, and this is a hormone. It's called erythropoietin, and this is the one that is stimulating bone marrow and causing production of red blood cell. So if somebody kidney is damaged, then a lot of waste products and a lot of toxins accumulate in the body. They will have hypertension, they have electrolyte imbalance, the blood pH decreases, become more acidic. They will have a problem with calcium, so the calcium level decrease, and they will have bone problems, and they also have anemia. So they will have a lot of issues. So from the anatomy point of view, urinary system has 4 parts. So initially we start with the kidneys. You have 2 kidneys, one on each side, below diaphragm, and it's behind the peritoneum. If you don't remember peritoneum, it is one layer of epithelial tissue that wraps around some of the abdominal organs. So kidney is located behind peritoneum. That's in chapter 1, if you remember. So from the anatomy, structurally, you can see that the kidney has a capsule. This white area that you see, the very thin white area, it's a connective tissue. So kidneys are wrapped by a capsule. Then the kidney itself has 2 layers. One is called cortex, which is the superficial layer, and medulla, which is the thicker layer. So this brown area that you see, these are called renal pyramids, and that's part of the medulla. So this is the base of the pyramid, this is the tip of pyramid, and that drains here in the calyx. These calyces are the plural form of calyx, drain in this larger area, and that's called renal pelvis. And then renal pelvis drains in the ureter. The area that renal pelvis leaves the kidney, this is called hilum. Hilum also contains a couple of other structures, and this is the renal arteries and veins. It's also the nerves and the lymphatic vessels are there. It's not shown in this image. So that is the area that these structures either enter the kidney or leave the kidney. The kidney, you can see, is very vascular. Lots of blood is coming through the renal artery. The blood is filtered, and then the rest of the blood is leaving through the renal vein. Okay, so here you can see an area of the kidney which is more magnified under the microscope, so you cannot see it by your own eyes. This whole area is called a nephron. So nephron is the unit of the kidney. So the way that you can look at it here is that these are the blood vessels that are coming, so it's oxygenated blood, and this is going toward this area. Okay, so this is why it's called afferent. So it's going toward it. This is creating capillaries, so a lot of capillaries here, and those capillaries are called glomerulus. Okay, and then it's leaving the capillaries, and when they are leaving, that's called efferent. So these blood vessels are going, and then they are wrapping through these tubules. So this is the glomerulus, which is capillaries, covered by this capsule. This is called the glomerular capsule or Bowman's capsule. So then the blood is filtered here. There's a lot of pressure here. It's filtered, and then the filtrate goes through these small tubules. So tubule means this is small tube. So it goes through this, and this is again is covered by these arteries. So the filtrate goes like this, and then gradually these arteries, these are capillaries actually, changing to veins. So then they drain to the renal vein, so become bigger and bigger and drain to the renal vein. So if you look at it here, we start here, so the blood comes here, and you can see that the blood is filtered here. So one of the function of the kidney is filtration. Okay, so not everything is filtered, only water, electrolytes, amino acid, glucose, vitamins, things like that. The smaller untoxic waste products, the smaller molecules are filtered. Proteins, red blood cells, bigger molecules, do not filter through this. From the glomerulus, then it goes to here. This is called proximal convoluted tubule. Proximal convoluted tubule, which is the same as this one, this area. So a lot of the electrolytes and water that was filtered is reabsorbed here. Then the rest of it goes to this area. This is called the nephron loop or Henle's loop, Henle, Henle. Here is some, it's important for balance of water and sodium and potassium. So then it goes here, and then that's called the distal convoluted tubule, this area. So a little bit of sodium is absorbed here together with a little bit of water, and then it drains in here. So this is the collecting tubule. This area is the collecting tubule. So here is important for the absorption of water. So if the body is dehydrated, so extra water is absorbed there. If it is not, then the water doesn't absorb, and that becomes urine. So the urine that is released from the body, that's excretion. So that's another name, excretion, EX-CRE. This area also important for balance of hydrogen. So that's getting rid of extra hydrogen. The other function is the reabsorption. So this is what I said before, that a lot of electrolytes are and also glucose and other stuff are reabsorbed here. Amino acids, vitamins are reabsorbed in this area. Electrolytes and water is reabsorbed here. And secretion. So some stuff are secreted for example, urea is secreted here, or acid is secreted. So it is from the tubules that is going here, from the wall of the tubules that's coming here. And excretion, as I said before, is that the fluid and the waste products that the body does not need, that becomes excreted, so it is leaving the body. The kidneys are connected to ureter, so you have two ureters, one on each side, and the ureter is a long tube that connects kidney to the urinary bladder. So the function of the ureter is to carry urine from the kidney to the bladder. Bladder is like a pouch. It is similar in male and female. It's very muscular, located in both male and female behind the pubic bone. This is the pubic bone here. This is the distended urinary bladder from outside, and if you cut it, this is the collapsed urinary bladder. In male, urinary bladder is located anterior to the rectum, so this area is hard to see it very well. This area is the rectum, so it's located anterior to that and above the prostate gland in male. In female, urinary bladder is located inferior to the uterus. This is uterus, and anterior to vagina. This is vagina. Then is another structure is called urethra. This is urethra in male and female. So in male, urethra is very long. It has three parts. This is the prostatic part. This is the membranous part, like membranous part, and this area is called the penile part, which is part of the penis. So in male, the urethra is long, and in female, the urethra is very, very short, and it is located anterior to the vaginal opening. Because urethra is very short in female, then that is a higher risk that women have, because they are getting urinary infection because it is very short. And if a male gets a urinary infection, this is usually a problem with the prostate gland, or they may have a congenital disease. So or maybe they are practicing some unhygienic sexual activity probably. So this is why male usually you do not have urinary tract infection. It's uncommon in male, but in female is very, very common because it's anatomical reason. It's very short. So medical specialties in urinary system, one is called nephrology. Nephrology is the science of studying kidney diseases. So a nephrologist is a person that goes into undergrad, and then from there they goes to medical school for 4 years, and then going to internal medicine for 3 years, and then is nephrology, which is another 3 years. That's average. Then you can subspecialize. Urology is treating diseases of the urinary system, not just the kidney, but urinary system, and some of the male reproductive organ system also. So a person that is practicing urology is a urologist, and this person again has to go into undergrad for 3-4 years, and then medical school for 4 years, and then 5 years of urology. Then you can subspecialize, or you can go to general surgery and then you can do urology. Depends on the type of residency program. So if the person, so how you can differentiate? So for example, somebody has renal failure, then or you have an infection, then they go to a nephrologist. But somebody has a tumor or trauma, then they go to a urologist. Or some if it's a male patient and they have a problem with their reproductive organ, they go to a urologist. If it's a female, usually they go to a gynecologist. So that's a little bit different between the two. Let's start with the sign and symptoms. So oliguria, oligo means too little, so that means that very little urine is produced here, usually less than 100 milliliters. So the common cause is dehydration, but it can also be renal failure. Polyuria, that means the person is producing too much urine, usually more than 2.5 to 3 liters of urine, and in this case the person may be drinking a lot or maybe having diabetes or some other conditions. They also the early stage of renal failure, people are producing a lot of urine. Frequency is related to how many times they go and urinate. It's not about the total volume of urine. So frequency, again, it can be from an infection or it can be from prostate diseases. There can be a lot of different reasons for it. And that is in male average normal times that a man goes to and urinates. That's around 5 times in 24 hours, and female is around 8 times in 24 hours. It's average, so it can varies a little bit. Diuresis is actually increased formation and secretion of urine. So this is not a sign and symptom, it's more a physiological condition. So for example, you give a diuretic and that will cause the increase in diuresis, or somebody is drinking caffeine, that will cause increase in diuresis. So it is more a physiological condition. You cannot say the person or this person presents with diuresis. So that is not a sign or symptom. Dysuria is two different condition. Okay, one is difficult urination and the other one is painful urination. So difficult urination means that the person has difficulty urinating. Normally the the urinary tract does not have any obstruction, but people with dysuria, they may have some obstruction. For example, they had catheterization before, they had a trauma in their urinary tract, or they may have some of sexually transmitted infections, and that cause fibrosis, and then that will cause dysuria. Painful urination is usually an infection. Okay, so a person comes with dysuria. This is usually an infection, but it can also be from trauma, so it may have different reasons. Urgency is that the person is feeling to go to the bathroom and urinate right away, and this is more a neurological condition. So normally you get a signal and then you can wait and you can go when the time is and location is appropriate, but in this case the person has to go to the bathroom right away, so more a neurological condition. Hesitancy is that when a person goes to the bathroom, they cannot urinate, so they cannot initiate urination, or even if they urinate, it will be small, that the stream of the urine is very narrow. Why is that? Because of BPH, benign prostatic hypertrophy, BPH, benign prostatic hyperplasia. Urinary incontinence is the person is not able to keep his urine and they urinate involuntarily. It's 5 different types. In male, the most common type is because of enlargement of the prostate, BPH, and in female it's called stress incontinence. Stress incontinence. That is because a woman had a normal vaginal delivery multiple times, and that will damage the pelvic floor muscles, and that will reduce support of the urinary bladder, and that causes incontinence. So, but there are other types also, the neurological ones. Enuresis is that a child urinates in his or her bed. So Normally up to age 3, the nervous system cannot control the urinary system properly, and that's why the children urinate. But then they are able to keep their urine, and then they can urinate properly. They can go to the bathroom and urinate. Um, but sometimes it happens that older children like 6, 7, 8, sometimes they urinate in their bed, and that is not a big alarming sign, because most of these conditions are psychological conditions. For example, parents are getting divorced, somebody in the family is very sick, a very high stressful situation, something like that. They may urinate and then it will go away, so that's not very alarming. But if they continuously urinate and after age 3, and they cannot train properly, that could be a congenital problem that usually there is a connection from the urinary bladder and then to urethra, or from the ureter to urethra, and then urine continuously drains. So that's a congenital disease, not common, but it can happen. Urinary retention is just the opposite of incontinence and uresis, and here the person is not able to urinate. Common condition in male is the BPH, so prostatic enlargement, and in female is a neurological condition like diabetes that will cause inability to urinate, so the bladder cannot contract properly. Okay, so calculus is the stone formed. There is different types of stone that the content of it is a little bit different, and that forms in the kidney, or sometimes it forms also in the urinary bladder. It's not the course that you're taking that is related to the math, and that will cause different symptoms depend where they are located. So if the stone is in the kidney, that's called renal colic. It's a very, very painful condition. The person has pain in their back, and then the pain radiates like a belt toward the umbilicus, toward belly button. Very, very painful. Hematuria, it means that blood is in the urine, so the urine is reddish. Sometimes people will have blood in their urine, but it doesn't look red at all, because it's a small amount of blood. That's called microscopic hematuria. Pyuria is pus in the urine, which means that there is an infection there. So pus is usually bacteria and damaged cell walls, and also leukocytes, white blood cells together. That makes it pus. So they usually have infection. Another condition is azotemia. Azotemia is accumulation of waste products, and mainly metabolites of amino acids. So it's a protein from protein metabolism. This is called azotemia. So increased nitrogenous waste products. And when the person has a sign or symptoms, then it becomes uremia. So if it is no symptom, it's called azotemia. When you get a symptom, that's called uremia. So the sign and symptoms of uremia varies. Usually the person have neurological problems, they may have skin problems, they may have heart problems, lung problems, bone problems, blood problems, and of course is kidney problems. So it will have a multi-system symptoms and signs. Okay, this is an image of showing kidney stone. So that if the stone is big, it's stuck here somewhere, and if the stone is small, usually it goes through the ureter, it goes to the urinary bladder. So that depends on the size of the stone. And if it is a bigger stone, it's usually stuck here and is less painful because it develops gradually. And if it is a smaller stone and then stuck here somewhere, usually in the area between renal pelvis and the ureter, and that is the one that will cause renal colic. So renal colic is an acute condition that is a sudden blockage of this area, but if the stone is really big, that the stone means that it's developed gradually and that does not cause renal colic. Glomerulonephritis. So glomerulo means that is the involvement of glomerulus, the area, the capillaries. Remember the capillaries that are formed and it's inside the Bowman's capsule. So it's inflammation of the glomerulus and other parts of the kidney. That's itis is inflammation. You know that. It has around 8 different causes. Majority of them are autoimmune, but some of them is also from infection. So in glomerulonephritis, the kidney is more permeable to proteins and the blood cells. So the person will have protein in their urine, and also they are losing red blood cells. Normally these are really big, so normally they cannot filter. So it means that the glomerulus is damaged, and that's why they are going through those holes from the kidney and they go to the urine. So they usually present with swelling. So they will have swelling of their face and their lower limbs, their abdomen, and they also, because of the protein loss, they have decreased blood pressure, and they are at higher risk of infection. Nephrotic syndrome is just a cause of glomerulonephritis, and here the protein is lost in urine. So not much blood, but protein is lost. Renal failure is the ultimate end result of any serious kidney disease. So that will result in uremia, which I talked about it before. So like any infection or autoimmune condition, diabetes, all these different toxins can cause renal failure. Any type of obstruction in the kidney, severe dehydration will all cause renal failure. So renal failure can be acute or chronic, and they are managed very differently. Acute tubular necrosis. So it means that tubules are damaged. Necrosis means dead. So here the tubules are damaged. So this is why I put this image. It's not in your PowerPoint. This is part of the renal tubules. So this is the area that urine and our filtrates are passing through, and these are the walls of the tubules. So these are made of epithelial cells. So if there's a toxin there, or sometimes infections that damage these epithelial tissue, and these epithelial tissue accumulate here in this area, and that blocks this area. So if this area is blocked, it means what? Urine cannot pass through and it's backed up, and that will cause kidney damage. So this is a cause of acute renal failure, and this will cause oligouria because urine cannot pass through, so decrease urine formation. Diabetic nephropathy, very very common condition that will cause renal failure. So people who have diabetes is not properly managed, then the blood vessels in the kidney become fibrotic, so fibrosis form there, not much filtration happens there, and the toxins cannot leave the kidney, the blood is not properly filtered, and the person will eventually end up in a chronic renal failure. Very very common cause of renal failure if it is not managed properly, if the diabetes is not managed properly. Urinary tract infection, it means infection in the urinary system. Usually it's a bacterial infection, but it can also be viral. Viral is more common in kids. The urinary tract infection it can be different types. The upper type is usually involve the kidney, so that if the person has a fever, and they have back pain, so that is lower back pain, that's likely the person has uh, you know pyelonephritis. Pyelonephritis is infection of the kidney, and then that person should go to the hospital. They have to go to the doctor, because if you don't treat it in 3 days, it can cause permanent kidney damage. Lower urinary tract infection is called cystitis. These cystitis and also pyelonephritis are in the term section of this lecture, so that's why I didn't put it. Cystitis cause also burning sensation, so dysuria, and very very common in women. So about 80% of women they get cystitis in their lifetimes. So the person does not have any fever, but comes with burning sensation or low like a pubic pain, and that's common. So usually antibiotics for 3 days, it will clear things up. Tumors of the kidney, so and urinary system, so I put all three of them here. So nephroma is actually, oma means tumor, if you remember it from the previous lectures, and nephro is kidney. So uh, benign tumors of the kidney is very rare, so this is actually a malignant tumor. It's called renal cell carcinoma. Carcinoma means it's coming from the epithelial tissue, and this happens usually in people above age 60, and they present with pain or bleeding, so their presentation varies actually from person to person, so it's not easy to diagnose it. Wilms tumor is also a malignant tumor, but is found in children younger than age 5, and this also has a bad prognosis. Bladder cancer is the most common cancer of the urinary tract. So if anybody, a man or a woman, presents with hematuria, blood in the urine, after age 50, so you have to consider bladder cancer as one of the differential diagnoses, so because it is a common condition. Infection, stones, they are risk factors for the bladder cancer. Also some paints, people are painting walls and things, they are at higher risk. Hydronephrosis means a condition that is too much fluid backup in the kidney. So here is a stone here, and this stone is blocking the area, so this urine is coming from the kidney but is being blocked, so everything is backed up, and the pressure increase in the renal pelvis and eventually in the renal tubules, and it will cause increase in the size of the kidney, and that will cause eventually, if it's not treated, renal failure. Nephrolithiasis is nephro means kidney, litho means stone, ice is an abnormal condition. So here is that stones in the kidney formed here. So here is in the urinary bladder, and here is, here is in the ureter, and here is in the renal pelvis, so the area junction between renal pelvis and the ureter. So the nephrolithiasis can cause hydronephrosis. So depends on the presentation. It will cause acute pain, or it may cause nephrolithiasis. And this is another image here that the renal pelvis is enlarged and this area is narrow. So this can be a stone, or it can be a fibrosis from damage, like a trauma or something, or it can be something from outside, for example a tumor outside of the kidney, or urethra is compressing this area, and that's causing distension of the renal pelvis, the calyces, and eventually the kidney itself. Okay, so polycystic kidney means what? It has poly means many, so it has a lot of cysts. The kidney has a lot of cysts. It is a congenital disease of the kidney. It can happen in children or in adults, and the normal kidney tissue is destroyed and replaced by cyst, which is made of fluid, filled with fluid, and this is a cause of renal failure. So people with this condition, they have enlarged kidneys, and they also have pain, and they have increased risk of infection. Nephropathy is a general term. It means just a disease of the kidney. It's not. It hasn't not been diagnosed yet, so you don't know the actual cause or uh, the diagnosis. So it's a very general term that anybody can use it. Nephroptosis means that the kidneys are uh, moved down. Okay, so it's floating, is moved down. What does it mean? It means that normally kidneys in a normal person is supported by a lot of ligaments and fat around the kidneys, so they are not moving, so they are not going downward because of the gravity. But in these people, they do not have that much support, and when they walk, and their kidneys also move a little bit, so they actually can feel it. And so this is why it is called floating kidney. That's the reason it's called floating kidney. Cystocele, it is mainly you see then in a woman, and this is the urinary bladder here, and this is the vagina. So when the urinary bladder fills up, it pushes against the anterior wall of vagina. This is the anterior wall of vagina. You cannot see the whole thing. And when you do a vaginal examination, you can see a mass in the anterior wall of vagina. So that is because of the bladder. Why is that? Because of the pelvic floor muscles are damaged because of multiple pregnancy and normal vaginal deliveries. If they have C-section, that this should not happen, but if they have vaginal delivery, it can happen, and the support is decreased, and this is why you see a mass there. Neurogenic bladder is that the nerve supply of the bladder is damaged, and that will cause retention of the urine, so the person cannot urinate properly. That can be from trauma, it can be from diabetes, or can be from some other conditions. Diagnostic test, one of them is called blood urine nitrogen, and here is this is the nitrogen waste product, or the urea is actually a byproduct of protein metabolism, and you look at the amount of that in the blood. So if the amount is high, it means the person may have kidney problem, because the kidney is not filtering it properly. The problem is that sometimes if somebody is eating a lot of protein, uh, or if there is a bleeding happens in the gastrointestinal system, blood urea nitrogen also increase. So this is why I said may indicate uh, kidney damage. But if I skip this one for a second, I go to creatinine clearance. This is also a function of the kidney. Creatinine is actually a byproduct of metabolism of protein. So if the creatinine is high in the blood, it means what? The person may have may have a kidney problem. So if somebody comes and you think the person may have a urinary tract problem, a kidney problem, you have to do the blood urine nitrogen and creatinine. And if these two are high, it's very likely the person has kidney damage. And creatinine clearance is comparing the amount of the creatinine in the blood and in the urine. That's what it means. So if somebody you think that they have a problem with an infection, then uh, you can do you know get a sample of the urine. There's two ways to take a sample of urine. One is through the catheter, which is not recommended all the time, and this is an easier one, and this is called clean catch specimen. So what happens here, that the person goes to the bathroom and urinates a little bit, then urinate in a cup, and then close the cup, and if they want, they can urinate the rest. So the reason for that is that you may have bacteria in the urinary tract, in the ureter, in the urethra. So when the person urinates in the beginning, so that urine is acidic and clears up all the bacteria from the urethra. So the second part that the person is taking and putting the urine in the blood, in the bottle or in the cup, that is clear. So it's cleared of all the bacteria. So that specimen can be used under a microscope, or it can be used for culture. So this is to reduce false positive for the bacterial infection. And urine analysis is very common test that you can do it to they can look at physically for the color of the urine. So if the urine is clear, it means it has a lot of water in it, and if it is dark, and that can be normal, is concentrated urine, or it can be a problem with the liver, or it can be problem with the red blood cells. Also, if it is smells a little bit, it means it can be a bacterial infection. So there is multiple reasons. If it is red, it means it can be hematuria. So there is bleeding. There is a blood there. So there is a bleeding happens in the urinary tract. Then they can put under a microscope. They can look at red blood cells, white blood cells, bacteria, to rule out any kind of infection, and also they want to rule out any kind of diseases like cancer or trauma or glomerulonephritis from the differential diagnosis. Then they can look at urine pH, they can look at the glucose level, they can look at electrolytes and other stuff, and then that information can give them some extra diagnostic tools for differential diagnosis. They can look at the crystals, so those are all for differential diagnosis. You can also do diagnostic imaging. One is called cystography. Here you fill up the urinary bladder with contrast, and you can take an X-ray. So for example, if there is a tumor here, then this area looks dark, look blackish in this area. So that way you know the person has a disease of like a cancer. Intravenous pyelography is that they are injecting contrast into the vein, and then the person they take an X-ray of the person, and the contrast is filtered from the kidneys on each side. Then you can see the renal calyces here, the renal pelvis here, and then is the ureter, each ureter, and then it goes to the urinary bladder. This is not that commonly used because it can increase risk of acute renal failure. So this has been replaced with a CT scan. So the reason for this test is to look at the function of the kidney. So if this, for example, this is not there, it means this kidney is not working. They can also look at the anatomical features of different parts of the urinary system. So if there is a blockage here, they can see it. If there is one area is dark in color, it means there is a mass there. So that way they can look at it. But nowadays CT scan can provide different and better information, so you don't need it. KUB is kidney ureter bladder. It's a plain X-ray of the abdomen. You want to see if there is any abnormalities here, and in this case I put it here. Look at this. This is actually a stone. So a stone contains calcium, and calcium looks like a bone, so it's dense, and you can somebody comes with abdominal pain, and then you can pick up this, and you can say the person had a kidney stone or ureter stone. So it depends on the location. A nephrogram is that you can look at the kidneys. In this case, both kidneys, you can see it very clearly, so there is no damage in the kidneys. And parallelogram is that looking at the renal pelvis in this area, so you're looking at the function and the anatomy of the upper part of the urinary system. A retrograde pyelography is that they put a catheter in the urethra and then in the urinary bladder, and they fill the urinary bladder, and then they go to ureter and fill that area. So you can see the renal calyces here, the renal pelvis, the ureter here, and the urinary bladder. So they're looking for anatomical abnormalities, so congenital abnormalities, any kind of obstruction, masses, things like that. So this is similar to IVP that I talked about it in the previous slide, but the good thing about this one is that there is no risk of renal failure. So that's the good thing about it. Avoiding cystourethropy is that they put a catheter through the urethra and then they fill the urinary bladder and then they ask the person to urinate, and then they take x-ray pictures here. So why is this? Because during urination the urinary bladder contracts, and if you see part of the contrast goes back to the ureter, it means this area has a defect. So normally it should not go to the ureter. So some children, they may have this congenital defect, and the urine goes back to the ureter, and from there it goes to the kidney. So these children, if you are not treat them by age 4, they will get hypertension and kidney failure when they become an adult. So that's the reason. Another reason for this is that they look at the urethra to see if there is any kind of abnormalities, any kind of obstruction in the urethra, or if there is any kind of damage from trauma in the urethra. This is what they also look at that. Another way, this is a more invasive procedure. So somebody comes, for example, with a hematuria, and you think it might be from the urinary bladder, so it's risk of cancer. You want to reduce that. You want to explore that diagnostic reason. So you can put a cystoscope there. There's two types of cystoscope. One is flexible. This is the flexible one. This is used for men, so they can look at, this is the camera, and they can look at it, and there's a light there, so you can look at it. You can also take samples from the urinary bladder if you think there's a cancer there. But it's not just cancer, there's some other disease also there that you can take samples. And this is for female. This is the rigid one because the female urethra is straight and is short, so you don't need the flexible one. And again, if you see a mass here, for example, the stone there, you can see it. If there is any other diseases, you can see it. And this is if you don't like somebody, a male patient, then you can use a rigid cystoscope to see the urinary bladder. No, I'm joking. This is in the past, so nowadays they have flexible cystoscope, so you don't need to use the rigid cystoscope in male patients because it's very painful. And urethroscope is to look at the urethra. So as you are removing it, you can look at the urethra for any kind of obstruction. So the treatment, one of them is catheterization. So here is the catheter. You can put it in the urinary bladder. It can be used for two different reasons. One is to take a sample of urine. This is for patients that may have urinary tract infection. Not recommended because it introduces infection also. So if the clean cash sample is not available, that option is not there, then you can use catheterization. And then you can put dilate this balloon, so, and you try to pull the catheter out a little bit, so that way this balloon is to prevent dislodging and displacement of the catheter. So the catheter stays in the urinary bladder. Also, for people who are going to gynecological surgeries and urinary surgeries, or people who have incontinence, the people may have urinary retention, you can use catheterization there. So there is different reason for catheterization. Extracorporeal shockwave therapy is lithotripsy is to destroy stones. Okay, so if you have stones there, you can use this ultrasonic sound and break it down to smaller pieces. So these are used for bigger stones to make it to smaller pieces, and then the smaller pieces go to the urinary bladder, and then the person can urinate. So that comes out naturally, so without doing any kind of surgery. Then is dialysis. So dialysis is used for patients that have a renal failure. So there's two types of dialysis. One is called hemodialysis, that is filtering blood, and the other one is peritoneal dialysis, which you use a peritoneal cavity. Each one has its own benefit and also risk. For hemodialysis, the benefit is that it's done only 3 times a week, and it's only a few hours. Excuse me. And it is better, actually. It filters better. The problem with that is the person has to go to the hospital. Sometimes the person cannot do it himself or herself, so somebody else has to take the patient to the hospital. It is 3 times a week, so it means that the person may have to change their jobs, or they may lose even their jobs. And also very costly, because going to the hospital is more expensive, and because you are filtering blood, then you can introduce bacteria in the blood, so that's another risk. For peritoneal dialysis, the person has a connection in their abdominal cavity, and they can put fluid at night, and they can sleep, and then wake up the next day in the morning, and then they can filter or drain the fluid from their abdomen. So the peritoneal cavity is used as a filter to clear the blood. The good thing is that the person does not have to go to the hospital. They can do this, and they can go to sleep, and it is less costly. There is no connection directly to the blood, so risk of infection is lower. The problem with this is that you have to do it 7 days a week, and also it can introduce infection to the abdominal cavity, so that's another problem. So each one has benefits and risks. Some surgical treatment. One is nephrolithotomy. So for the nephrolithotomy is that you're removing the stone directly from the kidneys, and if these are stones are bigger, you cannot destroy it, so you can open the kidney, renal pelvis, and you can remove it. Renal transplant is that you can give if somebody has chronic renal failure and been to dialysis, but the treatment of choice for the renal failure is renal transplant. So while the person is waiting for renal transplant, you can do renal dialysis. So here you can put another kidney, and they usually they put the new kidney in the renal in the pelvic area, because it's easier to access, and they can keep their own kidneys if it does not cause any kind of infection or is not the reason for hypertension. They can keep the old kidney. They can put a new kidney in the pelvic area. Antispasmodic is that to reduce spasm in the urinary tract, and they usually used for people who have stone, so they relax the ureter, and that way the stone calm down. So the diameter of the ureter increase and the stone calm down, and that also decrease pain. Diuretics is to increase urine volume, so people who have hypertension, for example, they can use diuretics. That is one of the treatments for hypertension. And lithotripsy is just breaking down to stone to smaller pieces, and that depends on the location of the stone, so that breaks it to smaller pieces. And that is it. So if you have any question, we can talk about it when we meet each other later. Thank you.